Sports massage reduces the chance of injury and enhances athletic performance, giving athletes a competitive edge. It can also help the average exerciser prepare for and recover from vigorous exercise. It provides both physiological as well as psychological benefits that help athletes and exercisers meet the challenge of physical activity.
Hello, I'm Benny Vaughn. I've been a sports massage therapist for over 20 years. I'm also a certified athletic trainer and a certified strength and conditioning specialist. I've used sports massage techniques to help collegiate and professional athletes stay healthy, recover from competition, and perform at a higher level. This video is designed to show you, the sports health care professional, how to incorporate sports massage into your existing program. You'll learn fundamental sports massage techniques and how to care for several common chronic musculotendinous complaints. First, let's look at the benefits of sports massage.
Athletes, coaches, and sports healthcare professionals report many physiological and psychological benefits of sports massage. Sports massage helps achieve a sense of readiness for competition and reduces performance anxiety. It also enhances recovery when used after competition. Many athletes suffer from minor musculotendinous complaints that cause discomfort but don't prevent them from competing or training. Sports massage helps reduce post-activity edema, which can lead to soreness and discomfort. Plus, it reduces pain sensations resulting from minor musculotendinous injuries. It can also help in the resolution of chronic musculotendinous injuries.
Many sports healthcare professionals find they have an advantage over their peers if they know how to provide the numerous benefits of sports massage to their athletes and clients.
We use sports massage at Northwestern in a variety of different ways, from pre-event massage on game day to get them ready for competition, and in a preventative way to help prevent soft tissue injuries. And then if somebody sustains a soft tissue injury, be it a hamstring or a tendon problem, we'll use massage to help speed the recovery of that injury. We have several athletes at Northwestern that really rely on sports massage as part of their regimen throughout the week, in particular post-event massage to get them ready for the next competition.
Understanding your athletes' or clients' needs will help you determine where you're going to deliver sports massage and what equipment is necessary. You can provide massage in a dedicated area in your facility, at the competition venue, and on the road. Let's look at a typical on-the-road setup.
Most massage tables are portable. They should feature adjustable height, double locking legs, proper padding, and a head support structure. The double locking legs add stability and sturdiness to the table, which is crucial if you're working with large people. Each massage table should have a weight limit. A head support structure will help the sports healthcare professional access the head, neck, and upper back safely, preventing neck strain and discomfort in the athlete or client. Another option is the field chair. These light, easily portable massage chairs take up little space, so they're great to use at the competition venue. You will also need massage cream, lotion, or gel. Products especially designed for massage provide the proper viscosity for sports massage techniques. Some of these creams have analgesic properties, which can be very helpful to the athletes and clients if they have minor musculotendinous complaints like sore muscles. Many available sports medicine ointments, lotions, and creams are not suitable for sports massage because they don't provide the appropriate viscosity to perform the techniques. And direct contact with these ointments can be irritating to the sports healthcare professional.
Improvising with standard training room equipment and supplies may lead to injury of the sports healthcare professional and mixed results for the athlete or exerciser. Knowing your athletes or clients' needs will help you choose the best equipment for your program. Once you have a handle on the logistics, you'll need to learn the fundamental techniques and when to use them. Now I'm going to show you and some student athletic trainers the fundamental sports massage techniques of compressive effleurage, compressive petrissage, compression broadening, deep transverse friction, and active assisted massage. I'm here with Brooke, a student athletic trainer, and our athlete today is Heidi, a volleyball player. I'll be demonstrating compressive effleurage. Compressive effleurage is a technique that's used to move lymph and blood through the system. It's also an important technique for athletes to help them with recovery. I'll begin with the technique by first draping our athlete. A towel is used to cover the athlete to keep them warm and to protect their outerwear from the lubricant that we'll be using. The towel is simply tucked beneath the outerwear while the unaffected side will be kept warm. Compressive effleurage is a technique that requires that the hands conform to the tissue area and a stable stance is used to apply good pressure. I'll first apply the lubricant to ensure that we're able to glide along smoothly. My hands conform to the tissue area while my stable stance allows me to move my hips forward and back, forward and back. My hands conforming to the tissue area and applying good, moderate to heavy pressure. We'll have Brooke try this stroke now, compressive effleurage, to demonstrate how easy it is to utilize this stroke. So Brooke, if you'll step in here, let's apply some lubricant to her hands first. And then she'll apply the lubricant to the athlete's lower extremity. We first make sure that Brooke is in a good stable stance. One foot is forward, one foot is back, so that her hips are facing the direction that she'll work. Her hands are now placed on the area, no spaces between the fingers, so that we've got her hands in a position to take full advantage of this full hand contact. She now moves forward, she glides along using her hips. Notice the great hip movement to provide adequate opportunity to use good pressure. Her hands are held closely together, no spaces between the fingers, so we can take full advantage of this full hand contact. Our next technique is compressive petrissage. Compressive petrissage is used to enhance recovery as well as stimulate muscles. It's a technique that involves lifting, kneading, and moving the muscles to enhance both elongation and broadening potential. Compressive petrissage is used best with recovery for the athlete. Let me demonstrate the technique. Again, I'll apply lubricant to the area. My hands will conform to that tissue area. I'll assume a stable stance and allow my hips to drop so that my hands can conform to that area. Compressive petrissage involves kneading the muscle tissue, lifting the muscle tissue, all of this stimulating the muscle tissue to allow for both good recovery, but it's an excellent use for pre-activity as well. Compressive petrissage is generally done on muscle groups instead of an individual muscle. Be careful to focus your massage on the entire muscle, especially the muscle belly. Compressive petrissage is used most often in conjunction with our compressive effleurage. Let's have Brooke, our student athletic trainer, try the technique now. So if you'll step around here, Brooke, let's apply some lubricant to the tissue area. And once we apply the lubricant, Brooke will assume a stable stance. Her hands are conforming to the tissue area, in this case the calf muscles, and she lifts knee of the calves by moving her hips simultaneously to give her her best opportunity to apply good pressure during this compressive petrissage application. Brooke will then move up to the hamstring muscles, where she continues to squeeze, to knead the muscles, and to lift the muscles. Within an hour or less before competition or exercise, compressive petrissage can be used to prepare the athlete for competition. The pace should be brisk, the pressure should be light. After competition or exercise, compressive petrissage can be used to assist with recovery. The pace and rhythm is slower and the pressure is heavier. This compressive petrissage technique is used in conjunction with compressive effleurage. The two in combination will produce dynamic results. And Brooke is doing a good job of keeping her fingers together, her hands are conforming to the tissue area, and notice the slight hip movement that gives her good pressure with this technique. That's very good, Brooke. Good work. Compression broadening is an excellent technique to use for athletes involved in repetitive motion activities like running or swimming. Compression broadening begins by applying pressure to the muscle area. I'm using a closed fist technique that allows me to use adequate pressure. The pressure then moves out medially and laterally, allowing me to broaden the muscle. Compression, broaden, compression, broaden, compression, broaden. We'll have our student athletic trainer, Brooke, try this technique. So Brooke, if you'll step over here, let's apply pressure first with a closed fist. This allows Brooke to use her hips and her stable stance to really apply good pressure. She starts to move her hands out medially and laterally, broadening the muscle. This helps make muscles more pliable. Muscles work better when they are pliable and more elastic. That's very good, Brooke. Compression broadening enhances muscle function, which may improve both speed and strength potentials. Deep transverse friction can be used in the care of subclinical or chronic tendonitis. It can also be used for tendinous attachments that have been overstressed. The thumb is placed at the tendinous attachment and adequate pressure is used, so as I move my thumb to and fro or transverse, it allows me to utilize adequate pressure and movement to provide good deep transverse friction care for this area. Now I'll have our student athletic trainer, Brooke, try this technique. So Brooke, if you'll step into position here, you'll bring the arm up so that it allows you access with your thumb. The thumb is placed right at the tendinous attachment and the pressure is applied and moved transverse to the attachment. Now the pressure is good. Now let's just move your thumb just a little faster, a little brisker. Deep transverse friction works well when the technique is done at a nice brisk pace. Here you go, just a little faster, excellent. Again, notice the position, the stable stance, and the technique. That's very good, Brooke. That's excellent deep transverse friction. Remember, deep transverse friction is a great technique to use if you suspect scar tissue adhesions, common after musculotendinous injuries. We're here with Heidi, our athlete, our volleyball player, and joining us now is Drew, our student athletic trainer. Active assisted massage techniques require the athlete or exerciser to contract her muscles while the sports healthcare professional applies pressure and movement. The first one we'll learn is static compression with active muscle engagement. I'll begin first by placing my hands in a modified CPR position, one hand atop the other, to ensure that I'm applying good static compression. As I apply this compression, I'll instruct our athlete, Heidi, to extend her leg. So Heidi, if you will, extend your leg out and back down. I'll then move to my next position to ensure that I'm covering the quadriceps completely. Apply the static compression. Heidi extends her leg, moves down, and then one more time change my hand position to ensure that I'm covering the quadriceps completely and back down again. Okay, Drew, let's have you try this technique. So Drew will position himself where his hands are covering the quadricep muscles in this modified CPR hand position, and then as Heidi extends the leg, Drew's applying pressure during the active muscle engagement. He now moves to the next position because we want to be sure that we cover the entire muscle group that we're applying this technique to. Good work, Drew. That was excellent compression, good stance. Static compression with active muscle engagement helps elongate and broaden the muscle. You can apply static compression without muscle engagement to get good results as well, simply by applying the pressure without any engagement will produce excellent results. The following active assisted massage techniques involve lengthening and broadening. The first technique involves broadening with concentric muscle contraction. I'll demonstrate this technique. We'll begin first by applying lubricant to the hands, massage cream, and I will apply pressure and broaden Heidi's muscles while she concentrically contracts them. So Heidi, what I'd like you to do is extend your leg and I broaden. I'll change positions, have her repeat that. She extends her legs while I broaden tissue. One more time, compress and extend the leg while I broaden the tissue. The second technique involves lengthening while she eccentrically contracts the muscle. So in this instance, I'll have Heidi bring her leg into an extended position, and then as Heidi lowers the leg, eccentrically contracting it, I lengthen the tissue. Each stroke covers about 3 to 4 inches. I apply pressure, and as Heidi lowers her leg in an eccentric contraction, I lengthen the quadricep muscles with this stroke. So Drew, let's have you try those two active assisted massage techniques. So we'll start first with placing your hands where you can compress the tissue well, and then as Heidi extends the leg, Drew broadens the tissue. Very good. He changes position because we want to be sure that we cover the entire quadricep muscle group. As Heidi begins to extend, Drew is broadening, and then one more time to ensure that we're covering the area, compressing and broadening. Very good. Now we'll go to the lengthening technique. And with this technique, we'll have Heidi start with her leg extended, and as she lowers the leg, producing eccentric contraction of the quadricep muscles, Drew lengthens the muscle. That's very good, Drew. Let's do that one more time. Good stable stance, excellent hand placement, and the movement is coordinated with the action of the athlete. Good work, Drew. Active assisted massage techniques help reduce the tightness of myofascial binding. Complaints of chronic tightness, even when an athlete or exerciser stretches regularly, has full range of motion in the affected joint, is common for myofascial pain. Active assisted massage techniques can reduce this fascial tightness and discomfort. We'll use all of these techniques: compressive effleurage, compressive petrissage, compression broadening, deep transverse friction, and active assisted massage to address some common chronic musculotendinous complaints, as well as to help repair and recover from vigorous exercise. Practice these fundamental techniques on an uninjured person. Once you're comfortable with them, you'll be able to apply them to your athletes and clients. Now I'll show you how to prepare athletes for competition. The focus of pre-event massage is to increase the athlete's sense of readiness both psychologically and physiologically. Also, pre-event massage can reduce pre-competition anxiety, helping the athlete focus on performing his or her best. Pre-event massage is usually brisk and short in duration, 4 to 7 minutes. I'll demonstrate pre-event massage with our athlete Dorian, who is a sprinter. Remember, we'll take a towel to drape our athlete and do a simple towel tuck underneath the athlete's running short. The remainder of the towel helps to keep the leg that we're not massaging warm. We'll apply massage cream to the leg and the important aspects of pre-event massage is that we have full hand contact, hands are conforming to the area, and compressive effleurage, compressive petrissage, and compression broadening are all applied with full hand contact, done briskly, and we spend a short period of time with these pre-event sports massage techniques. Our focus is to produce a neurological effect while mechanically enhancing the muscle's ability for work. Remember, the point of pre-event sports massage is to stimulate, not sedate. So the techniques must be brisk, steady, and confident in order to get your best results. Multiple event sports like the decathlon and heptathlon, or tournament sports like tennis or swimming, require the athlete to participate in several bouts of competition in one day. Along with helping with mental preparation, recovery sports massage can be beneficial between events by reducing minor musculotendinous complaints like tight muscles and muscle spasms, cramping, and muscle fatigue. These complaints interfere with the athlete's performance but may not be serious enough to sideline him. Compressive effleurage and petrissage are excellent techniques to use between events. These techniques help reduce post-exercise edema and produce post-activity relaxation. This helps the athlete's muscles recover and prepare for the next competition. Full hand contact techniques like compressive effleurage, compression broadening, and compressive petrissage can also help the athlete recover overnight. Again, reducing the minor musculotendinous complaints that diminish an athlete's state of readiness can only help the athlete perform his best. Recovery massage will last from 15 to 30 minutes. I usually concentrate on the primary muscles used in the competition. So far, we've discussed many massage techniques for healthy people. However, you may have athletes and clients who are injured. Sports massage can be used in conjunction with other established treatments to help speed healing. In the next section, I'll show you how to use sports massage to address several common chronic complaints, including tennis elbow, muscle strains, Achilles tendonitis, patellar tendonitis, ankle sprains, myofascial pain, and neck pain from torticollis. Chronic musculotendinous complaints can be frustrating for the athlete or client, as well as the sports healthcare professional. Many musculotendinous complaints recur or just fail to completely resolve. sports massage can help. Whenever I'm faced with a common chronic complaint, I use the CCT model: condition, characteristic, technique. First, identify the condition. Then you must understand the characteristics of that condition. Finally, apply the appropriate sports massage techniques that address the cause of the complaint. In other words, match the physiology of the musculotendinous complaint with the physiological effects of the specific massage technique. Addressing the cause of discomfort is the key to determining effective sports massage care. I'll use the CCT model to demonstrate how you can care for some common chronic complaints. Tennis elbow is characterized by pain and tenderness on the lateral aspect of the elbow. The tendon fibers of the common extensor tendons of the wrist attach on the lateral epicondyle of the humerus. Trauma and micro-tearing of these tendon fibers result from overuse and excessive eccentric loading of the extensors. Deep transverse friction and active assisted massage techniques can be very effective in caring for chronic tennis elbow. Deep transverse friction helps to encourage functional alignment of any scar tissue that's developing. I'll demonstrate deep transverse friction using Heidi's forearm and elbow. I'll apply some massage cream first using some nice compressive effleurage strokes in order to prepare the tissue area for the deep transverse friction. The transverse friction will be applied to the lateral area of the elbow where the problem is typically found, at the attachments of the common extensor muscles. I'll apply my thumb and move back and forth in a very rapid, brisk manner, applying both transverse friction and adequate pressure in order to make this technique effective. Notice that I move my thumb into several positions to ensure that I'm covering all areas of the tendinous attachments. Deep transverse friction should be done rapidly, should be done briskly, and it should be done with great confidence. Following the deep transverse friction, I'll utilize an active assisted massage technique. In this instance, we'll utilize the lengthening technique that involves the athlete contracting the extensor muscles by having her hand in a wrist extended position, and as she begins to bring her hand down into neutral position on the treatment table, using the pads of my thumbs, I will lengthen those common extensor muscles. We'll bring her hand back up again, and then bring your hand down towards the table. Very good, and one more time. In that position, we'll start with the lengthening action. We can also use static compression with active engagement. This is a very effective technique for individuals suffering from tennis elbow complaints. I'll begin by placing my hand in this modified CPR position, one hand atop the other, covering the entire body or belly of those extensor muscles. And in this position, I'll now have Heidi bring her hand up into a wrist extended position, and then she takes it back into the neutral or starting position while I apply the pressure. I'll change my position a bit more to ensure that I'm covering the entire area of these muscles. Heidi brings her hand up again. I'm applying static compression, and she returns her hand into beginning position. This is static compression with active engagement. In most cases, these techniques help reduce discomfort and can restore pain-free movement. Tennis elbow can be treated with deep transverse friction and active assisted massage techniques successfully. Muscle strains occur due to the overstressing of the musculotendinous structures. Characteristics include mild to severe discomfort in the affected muscle with some loss of optimal function. Deep transverse friction, compressive effleurage, and compressive petrissage work very well with mild to moderate muscle strains. A common chronic muscle strain is a hamstring strain, which is easy to re-injure and often difficult to heal. After compressive effleurage and petrissage, apply deep transverse friction at the site of the injury. Compressive petrissage and effleurage are used frequently to prepare the area for good deep transverse friction applications. This technique helps the formation of a functional scar that is both strong and pliable enough to regain pre-injury range of motion and flexibility. Follow up with compressive effleurage, which can help return proper biomechanical balance by decreasing muscle spasm. Compressive effleurage is useful in the rehabilitative phase. Muscle strains respond well to deep transverse friction, compressive effleurage, and compressive petrissage. Achilles tendonitis can be a painful and chronic complaint. The gastrocnemius and soleus muscles are capable of generating large amounts of force while supporting the weight of the body. The distal portion of the Achilles tendon, where most Achilles tendonitis pain occurs, has a poor blood supply. These two factors contribute to the microtrauma of the Achilles tendon. Compression broadening and compressive effleurage help alleviate discomfort and support the healing process from the microtrauma to the tendon. Compression broadening applied to the gastrocnemius can enhance muscle elongation. This elongation or flexibility of the muscle reduces tension on the Achilles tendon, which in turn reduces further microtrauma. Compressive effleurage helps flush out swelling associated with low-level exercise-induced edema. This helps reduce discomfort and further damage. Achilles tendonitis can be helped with the sports massage techniques, compression broadening and compressive effleurage. Patellar tendonitis is a serious complaint because it can last a long time. A common symptom of patellar tendonitis is pain in the front of the knee. Deep transverse friction, compressive petrissage, compressive effleurage, compression broadening, and active assisted massage techniques help quiet the pain of patellar tendonitis. After compressive effleurage and petrissage are applied to the quadriceps, deep transverse friction is applied to the patellar tendon and the connective tissue around the tendon. This will help mobilize the tissue and disrupt fibrous adhesions. After the deep transverse friction has been applied, we finish with good compressive effleurage strokes. And now we'll have our athlete Dorian assume a seated position on the end of the treatment table, where we'll utilize several additional strokes that are useful for working with patellar tendonitis. We'll begin first with compression broadening. And now we'll have Dorian assist us with an active assisted massage technique. Here we'll begin with Dorian bringing his leg up and back down. We'll start first with a broadening active assisted technique. As he brings his leg up, I broaden. He returns to starting position. He brings his leg up, I broaden, and we simply continue this until we have reached the entire area of the quadricep muscles. And then we'll work with lengthening the quadricep muscles by having our athlete start with his leg in a completely extended position, and as he lowers the leg in eccentric contraction, we apply a lengthening massage stroke to ensure good lengthening. And we'll repeat that one more time. And as the athlete lowers the leg, eccentrically contracting, lengthening that, we apply a lengthening stroke. Finish with good compressive effleurage. Patellar tendonitis can be cared for with deep transverse friction, compressive petrissage, compressive effleurage, compression broadening, and active assisted massage techniques. One of the most common musculoskeletal injuries in athletics is the lateral ankle sprain. The lateral ankle sprain generally causes swelling and discomfort. Compressive effleurage, active assisted massage techniques, and deep transverse friction all have a place in the care of ankle sprains. Compressive effleurage to the lower leg muscles like the gastrocnemius, soleus, and ankle everters will help reduce the muscle spasms. Compressive effleurage should be done with the hands conforming to the tissue area. Along with compressive effleurage, lengthening applications to the ankle everters will be useful in helping with ankle sprain conditions. One can either use a full hand contact for the lengthening of the ankle everters or a closed fist contact to lengthen the ankle everters. Deep transverse friction for ankle sprains where you suspect adhesions, scar tissue forming, can be accessed with deep transverse friction. Deep transverse friction to the injured ligaments combined with range of motion exercises enhances proper alignment of scar tissue and encourages functional repair of the injury. Take care to only use deep transverse friction after the acute injury phase. Lateral ankle sprains are extremely common and can be helped with the sports massage techniques, compressive effleurage, and deep transverse friction. Any muscle is capable of holding an increased level of neurological activity that can maintain a spasm. The spasm will lead to increased pain and disturbed biomechanical function. This discomfort is often referred to as myofascial pain. Static compression, compressive effleurage, and compression broadening can help disrupt a muscle spasm and bring comfort and ease of motion. Myofascial pain can be attributed to injury in the sports arena, but it may also be triggered by caffeine, certain medications, neuromuscular trigger points, or emotional stress. The wide variety of causes makes myofascial pain probably the most common complaint the sports healthcare professional faces. After applying compressive effleurage and compression broadening, static compression can interrupt and eliminate muscle spasms. I'll begin by demonstrating compressive effleurage and compressive petrissage on our athlete Heidi. Doing compressive effleurage and compressive petrissage helps to prepare the muscle tissue for more specific techniques. After these two techniques are applied, I will then apply compression broadening. Here I'm using the pads of my thumbs to produce a broadening effect while utilizing compression simultaneously. This compression broadening can be useful in helping to facilitate better elongation as well as broadening for this muscle during activity. After these techniques have been applied, static pressure. Here I'll use one finger atop the other to apply static pressure to the muscles located between the shoulder blades. I can also utilize my thumb with active pressure in the area of the shoulder blades as well. The static pressure is essential for helping to interrupt the pain spasm cycles that many athletes experience with myofascial pain. I can end this approach by using deep transverse friction. Here I'm applying deep transverse friction using one finger atop the other to ensure that I have a good contact point and I'm able to apply a very brisk movement along with that static compression. Deep transverse friction is a useful technique for working with myofascial pain that athletes might be suffering from. Static compression along with compressive effleurage and compression broadening are useful in breaking the muscle spasm cycle and reducing discomfort. Torticollis or wry neck often occurs when the neck is turned abruptly or is required to support a load that it isn't strong enough to support. Common characteristics of torticollis are acute muscle spasm of the posterior cervical muscles, pain triggered by neck movements, and impaired mobility due to discomfort. Static compression, compressive petrissage, and compressive effleurage can help alleviate the symptoms of torticollis. When you're working with an athlete who has pain in the muscles of the cervical area, it's important to begin with some good compressive petrissage and effleurage to this area. I'll begin first on Heidi's left shoulder with some good compressive petrissage, and then we'll utilize some good compressive effleurage to ensure that we are accessing all of the muscles in this shoulder and neck region. Following these two techniques of petrissage and effleurage, I'll finish with some static pressure applied along the occiput of Heidi's neck. So I simply take the pads of my fingers, find the occiput area, and apply static pressure. I'll change position periodically with a slight bit of movement, apply the static pressure. Again, one more time, a little circular movement, apply the static pressure using the pads of my fingers along the occiput area of the neck. To help alleviate the painful and chronic condition of torticollis, first start with compressive petrissage and compressive effleurage and end with static compression. Sports massage can broaden the services you offer your athletes and clients, as well as improve their performance potential and reduce the discomfort from minor musculotendinous complaints. In this video, we've covered sports massage program needs and the massage techniques you'll need to know to get started. We've also shown you the CCT model for treating common chronic musculotendinous complaints. These are the fundamentals to help you start helping your athletes and clients with sports massage.
For more information, check out Human Kinetics Sports Massage books, Performance Massage, and Understanding Sports Massage, as well as many other related titles.